TV show host and new mom Chrissy Teigen is used to making headlines, but this morning she has people talking for a very different reason. She is opening up about her struggle with postpartum depression. She says it's something that we need to talk about more often. And joining us now to discuss postpartum depression is Dr. Dudley Brown from Good Samaritan Medical Center. Dr. Brown, thank you for being here this morning. It's a topic that is definitely not talked about enough.
Definitely. Thank you for having me. Postpartum depression affects approximately 10 to 15% of women after giving birth. And, you know, the statistics say as many as half of these women can start having symptoms before pregnancy or during pregnancy. Many people see having a child as a happy time, so they don't really give credence to when women express true feelings of sadness, which can happen with postpartum depression.
So what kind of causes postpartum depression? What brings it on?
Well, we know that there are risk factors. Some of the risk factors include a pre-existing history of depression, so women who've had depression before, stressful life events during or after pregnancies, such as relationship or marital discord, a stressful delivery, baby in the ICU, or a newborn that's sick. Sometimes chronic sleep deprivation, which every new mom knows that's standard, that can be a risk factor. Some personality traits, such as folks that are sort of particular, very neurotic, sort of like to control their circumstances, that can be a risk factor because, as any new parent will knows, there's not much you can control about having a newborn.
Yeah, but that's very interesting. Now, Teigen also said she experienced both emotional and physical symptoms, saying that some days she was actually in incredible physical pain. Is that a part of postpartum, or is that something separate?
Well, it can be. She attributed that to her history of anxiety, or to anxiety, and we know that sometimes your mental health symptoms can be manifested physically, and that's real. It's not in your head. You actually have physical symptoms, and so it just has to do with whatever pre-existing risk factors someone may have. And a history of anxiety is actually a pretty significant risk factor for postpartum depression. So it was within that realm where she had many of her physical symptoms.
So how does a woman know if she is suffering from postpartum, and then where should a couple go for help from there on?
Excellent question. So of the women who get postpartum depression after childbirth, we know that half of those women will have symptoms within the first 4 weeks. A standard practice in my practice is to do sort of a depression screen between 2 and 4 weeks when folks follow up. So that's helpful, so that some people are hesitant to reach out or to open that discussion because mental health carries such a stigma still in this country. But for the folks who are willing to open up, and we encourage everyone to, if you get past that 1 to 2 week mark and the symptoms of just being depressed, uncontrollable crying, low energy, not looking forward to the future, not getting joy, not really having true joy in the things around you, if those things are happening, speak to someone. Speak to, I like to say, your tribe, the people who support you, whether it's your spouse, your family, your friends. Speak to someone, and hopefully those folks will have no judgment. And if you don't feel comfortable speaking to them, then reach out to your provider. Your provider who delivered your child, you've known for many months. Hopefully by then you're comfortable speaking to them or their staff about what may be going on, because I guarantee you, as long as you reach out, they're going to respond appropriately, bring you in, and if they don't, then reach out to someone else. And of course, there are always crisis lines for the folks who really get in trouble, because postpartum depression, a subset of it can also be postpartum psychosis, and folks can get suicidal or homicidal thoughts.
Wow.
So there's always crisis lines where folks can go to get intervention.
Dr. Brown, that's some excellent advice that you shared with us today. Thank you so much. Hopefully people out there will start talking about this a little bit more.
Actually, yes.